Hello all, welcome to my channel. I am Dr. Dheeraj Masapu and today we are going to discuss the prospects of critical care medicine after MD anesthesia in India. And we have Dr. Girijapati who has done his FNB in critical care medicine after MD anesthesia. Right now he is associate consultant in a big corporate hospital in Bangalore. So we are going to ask him several questions about doing critical care medicine after MD anesthesia and how it is going to be, and what are the different courses available in India to practice critical care medicine, and how to prepare for the exam, and several things we are going to discuss today. So welcome to the channel, Dr. Girijapati.
Thank you, Dr. Dheeraj.
So my first question to you would be, what are the different courses available in India for MD anesthesia students
Post-MD anesthesia.
to practice critical care medicine and to be called as a qualified intensivist in India?
Yeah, so this is one primary question for anyone who finished the MD anesthesia. Okay, so they'll be a bit confused also. There will be a n number of options will be available. So we'll make it very much free for them. Okay, so whatever the information we know we are sharing, but the audience should be analyze all the things. They have to take their own decision. So even if they have queries, they can let us know. Yeah. Okay, so coming to the options available in India. So before going for which course to be there, you have to be clarity about where to practice your further things, and depending on the interest. Okay, so if you are want to there are mainly available options are, one is DRNB and IDCCM, and others are available. So they are available in one or two places, so that's why you're not concentrating on those things. So main thing is available is DRNB and IDCCM. Okay, so if you have full interest into the critical care, you want to settle fully into the critical care in metro cities or in second tier cities, DM is available, so equivalent is DRNB. So in a good corporate hospital, these are the first options. Okay, but you have the other options, I want to practice anesthesia also along with the critical care. I'm settling into district hospital, some taluka hospital, in a small nursing homes, own nursing homes will be there. I want some knowledge about critical care and some legally to be safe, some critical degrees there. IDCCM is the best thing, okay, because it has good structured course almost equivalent to EDIC. Okay, so that is the second option is available. Okay, after the MD anesthesia, okay, you not worked in critical care during your anesthesia training time, so I'm a bit confused and all. There is no hurry, so you can take 6 months to 1 year. You can work in a critical care unit, understand the system, understand the pros and cons. Then you can take your own decision upon that one. Because if you join to the course, you can't stop it in between. So you can take a controlled chance about those things. Okay, so other things. If you want to go to overseas immediately after MD anesthesia, as if you are interested in critical care, so it is bit confusing situation. If you want to go to some Australia or US to some extent, so there again you have to be start climbing from the step 1. So they have their own course for 6 years. So then you have to complete this thing.
So what Dr. Girija is telling is, finish all the formal training in one particular way. Either choose a DM or a DRNB if you want to settle in cities, or you want to be a full-time intensivist. If you want to go for a tier 2 city or a town setup, then IDCCM would suffice. That is what he's telling. So I have done a bit of research about the number of seats available. I'm going to tell you that there are totally around 70 seats in DM category. They are in CMC, SGPGI, Tata Memorial, and Indira Gandhi, Madras Medical College, St. John's, KMC, and the list goes on. IMC, Ramachandra has a DM program. So total about 70 seats are there in DM category, and this is apart from the INI CET. So INI CET includes Institute of National Importance, AIMS, and AIMS, and other JIPMER, and those things will come under the INI CET. So DRNB, there are around 260 seats in India. So total club together, it will be around 330 to 340 DM seats. DM and DNB seats are available in critical care medicine. So I hope you understand the scarcity of the number of seats and how many people are competing for that. I have done the research. So this year onwards, very important thing, this year onwards, the DM and DRNB is kept under the medical group. So medical group means all the general medicine and anesthesiology and pediatrics. Whoever is interested to do the critical care medicine should write the general medicine category. In that, 7,700 people have written the super specialty NEET. So almost like the competition is slightly high, but there again a small point is there. So general medicine guys, usually the first priority would be cardiology, nephrology, rheumatology. So the number of people who are actually interested in critical care medicine would be low in that 7,000 number who are competing in the medical category. But if there are anesthetists in the top ranks, if they're writing medical group, that is surely for the critical care medicine only. So you should, why I'm telling the statistics is that it is not an easy exam and everybody cannot get into DM critical care and DNB critical care. So then you should have an alternate route also, like Dr. Girijapati is telling, IDCCM is a good option. And after that, we can edit.
You can like do IFCCM.
Okay.
So almost they will tell equivalent to like DRNB thing.
So IDCCM, IFCCM, if you do, they will be considered equivalent to DM critical care and DNB critical care. So EDIC, what is the thing?
EDIC thing is like it is one add-on degree. Okay. If you have done DRNB, nothing matches to DM. Okay. So you have like worked for critical care 3 years. Okay. So you want some degree like into the critical care. So legally you want to be safe and you want to be good knowledge about the critical care because that exam is also covers everything. So with that intention, one thing is you can do the EDIC. Other thing is if you want to go practice in UK, that is the one that is will be helpful.
Okay. If we are planning to relocate to UK,
the EDIC will be one of the easy path to enter into the UK.
Okay. Then they will have more advantage than DM critical care. I think so.
Because that is European degree. So they are like they will recognize the European degree. And if you want, you have the good experience in the critical care, so you don't have any degree. So then you can do the EDIC. That is only like just writing the exam. So you get the degree. That's the one thing.
So if you're planning abroad, then I think EDIC has more value. And if you are planning to go to Middle East also, EDIC will have more value than Indian degrees, because in the Middle East there is the categories of valuation for different countries. Usually Ireland and UK based and those degrees have more valuation. So that is how it is done. So that is about the number of seats and places where you can do and the competition we are trying to do. And my personal opinion is getting DM in critical care is surely tougher than getting DM in neuroanesthesia and cardiac anesthesia. Because the number of people competing, you see, in anesthesia group, the number of people competing is lesser. And in the medical group, the number of people competing is very high. So, but if you have a good preparation and strategy, then you can crack it. I'm not telling it is impossible, but it is tougher. You should have a plan from beginning. That is what I'm trying to tell.
Like you just forget your like anesthetist. So just start like reading medicine, because the question is set for the medicine for all the entrance exam. So it is like unfortunate thing, anesthetist has to write that paper because it is like hardly contains some of the anesthesia question. Previously it was like 60% will be medicine and 40% will be anesthesia, almost like 50% chances. Now it is almost like you're competing with like same MD exam, with everyone you are competing. So it is should not be a problem. So because there is like MCQs, if you sit and try, definitely will be helpful. And many now everyone is coming with their own courses and all. So with that one you are able to do it.
Yeah, there are so many courses. I did a small research. Speed has a course
like
for critical care medicine.
Yeah, like many, but Speed and many of them now coming into the like especially into the critical care. Okay, but the very like for anesthetist you have to write the proper medicine paper. So that's the thing. Just like you can forget is anyway, like you are entering into the completely into the medicine based things. So you can like start preparation. So I don't think it should not be like make too much of difficulty in cracking the exam.
Yeah, but if they start preparing from first year of MD, I think they should be able to.
Yeah, even when I write for the FNB exam, so there also like questions hardly come from the anesthesia. More of them they like come from the acute care.
Okay.
So it should be easy for the thing to be cracked. Like it is not cause so much of problem.
Our suggestion is you start preparing, take some portal, Speed or Bhatia, so start preparing from first year itself. so that if you have a strong liking towards critical care medicine, and at the end of it, it will be easy for you, because if you start preparation after MD anesthesia, then it will be slightly
like
tougher.
tough. Bit difficult.
Yeah.
So you can make your mindset and your separate preparation for the critical care. It will be helpful during your training days of the anesthesia also.
And if they work more in the critical care postings during MD anesthesia, will it help for the examination?
Definitely, you will see the things like almost many things like medicine based only in the critical care. Okay, so definitely it will be helpful. Even if they're not able to crack in first attempt, even if they work in 6 to 1 year in the critical care, definitely it will help for cracking the exam. Because your mindset will changes, the approach will be, you'll get it that towards the medicine. So definitely if you work in the critical care during the training days, otherwise like if you're not able to crack in first attempt, definitely go for 6 months to 1 year training in the critical care.
So some hospitals don't have a very good critical care setup. Maybe after COVID, I think every hospital has. That is one advantage which happened to our country and all over the world. Most of the hospitals have a critical care. I think you have to request your professors and HODs to post you more in critical care if you have an inclination towards critical care.
And some of the hospital they will send to the other ICUs as a rotation basis. So that one, depending on your local protocol, you can take that advantage.
Correct. So next question would be, what are the stipends that DNB gets roughly, can you tell?
Okay, so as per my knowledge, all the corporate hospitals minimum 60 plus they will give. Okay, that is
60,000 per month.
60 for sure.
Yeah.
So in even some of the main metro cities like Delhi and all, even they get up to 1 lakh plus. Okay, so there is no problem, like up to 60,000 it will be like sure. So rest of the things will be fluctuating. So you can while selecting this place, you can keep this one also as a third or fourth priority about stipend.
Yeah, so stipend should not decide your place, but to survive we need money, and enough stipend will be given for your survival. And so next thing, how is the work timings and work-life balance during the studying, or after once you become consultant also, how will it be in general?
Like one thing is, as whoever from the anesthesia, they will enter into the critical care. Now first 3 to 6 months will be very depressing. Even I gone through that one. Because in anesthesia your mind and surrounding environment are different. Here it will be like pure medicine. You will feel like why did I join this course? But forget 3 to 6 months, just observe, you will learn the things quickly. Okay, so there is no need to feel depressed about like other people will be thinking something else and all. So no need to worry, like 3 to 6 months is sufficient. You will learn the things. They're like more of like many things you learn by seeing only. That's why you are doing this residency.
Got it.
Okay, so apart from that one, so like timings, some of the institutes have the different timings. In our institute you have 12-hour shifts. So 9 days, 8 nights. So rest of the 12 days will be get offs. Okay, you will adjust accordingly and you will get the offs and all. So one thing is bit upsetting is like you may not get Sunday off. Your family may be off, but you will be working. 2 Sundays sometimes during residency it will go off, but other 2 Sundays you can enjoy, but other days you will get the off. Okay, ours is 12-hour shift. Some of the hospitals they will have 8 to 5 shift. So night means they monthly get 5 nights. So they will get pre-duty off and post-duty off in some hospitals. And some of the hospitals they have 3 shifts per day, 8 to 2, 2 to 8, and night 8 to 8.
So if you're doing 8 to 2 shift, and then you will go at 2 o'clock and come again at 8 o'clock.
That's only like they have like you have to be work for 204 hours in a month. So they will split all the duties into equal shifts. So you can make adjustment among yourself. That's the one thing. And one more thing is academic activity will be happening in the morning. So that time even if you are not on duty, you have to come. But in our place, what you are doing is Zoom meeting. So even they can sit anywhere, they can attend. There is no need to travel from far place to attend just for the class.
Got it.
Okay.
So overall, I feel it's a balanced program.
Balanced program. So it depends upon your mutual understanding. You can continue that.
So MD anesthesia guys can cope up with this stress.
Definitely, first 3 to 6 months will be this thing, but you should not lose your hope. Okay, it is for everyone, not like for you or anything.
So basically, what Dr. Girijapathy is telling is a mindset shift should happen. So you should anesthesia is more like perioperative care. So the time you spend with the patient is minutes or hours. But here you spend days and days with the patient. So it's a totally different mindset. So you need to change your mindset when you're practicing critical care. So my next question would be, after finishing MD anesthesia, now they know what course to do and how to get the seat and how to prepare. But after joining critical care, so how the life will be, and what are your tips to excel as a critical care specialist?
So first 3 to 6 months I told like it will be a bit difficult, but just calm down and observe, you'll learn the things, will be like become expert in that one. Okay, next you will have your seniors to mentor local thing. Okay, so I don't want to like comment much because you will have the expert with you that time, so they will guide you in better way. But be active academically, so that definitely will help. Okay, other thing is my personal observation, be a good counselor. Okay. So critical care means 50% will be the like clinical management, 50% will be the counselor. Okay, in anesthesia you won't get that counseling thing because you will be much like perioperative thing, much not much interaction with this thing. Yes. Here like things will be entirely different. Okay, you have to be continuously with the patient and you have like very critical things will be there. Okay, so in anesthesia almost like 100% will be positive results only will be there. But in critical care you'll see many negativity. Okay, so you should prepare your mindset. Okay, you are making the things will be different. Okay, suppose if you save one patient of like 40 years, okay, you are saving a son for their parents, or you are saving one father for their kids, and you are saving one husband for this thing. Okay, so you are making much difference compared to any other branches. Okay, you are like in higher place. Okay, but it will be like teamwork. Okay, you may not get full recognition, but you have to be work like part of the system. But with your participation, the result will be there. But so you should feel positive for that one. So negativity also will be there. But you should. So during the DRNB course will be there. So immediately after the finishing the course, so some places, new hospitals, they may take you as a consultant. Okay, so that opportunity is coming down because many people are coming out of the thing. So now that opportunity is less. So you have to be, one thing is you are very much ready, means you can go to some corporate hospital, you can join. Otherwise same hospital, sometimes they will take you for junior consultant post. You can work for another 2-3 years. Then you can learn able to manage the patient independently, completely. If you go to some hospital, if they give the patient, you should be in confidence that I will manage this patient independently. Nothing will be required from the admission to till if the patient death happens, I am able to manage the patient independently. That confidence you should get it. Okay, so then you can go for junior consultant. Usually DRNB, the pay will get like from the beginning 1.5 lakhs. Okay, so depends upon the hospital. So if you are a alone person, you are taking care of 12 bedded alone, means then they may pay up to 4 lakhs. Okay, so that will be vary. So that will be the thing. Okay, so then the routine steps will be there. Initial attending consultant, then associate consultant and consultant. Okay, everyone will tell like 3 years. Okay, it depends upon your personal thing. If you have good communication with the other departments, with the management, and you are getting the newer things and you are getting the good results, then you may not like go the steps. Immediately finish the DNB, you can go directly into the consultant post. It purely depends upon your expertise. Okay, so if you have good communication and good result, good orientation, good dedication, then you can climb the steps easily and early also. Faster also. Okay, and critical care means one is clinical work, but you should not miss your academic work. Okay, so many publications will be coming and all. If you keep you active, okay, so many places will recognize you. Okay, that is the one path to be successful also. And your mind also will be active, you will feel positive also by doing the academic activity. So definitely you should not forget your academic activity. Okay.
So there are two ways of working after critical care. By the way you're telling, one is directly taking over a smaller hospital, or working in a bigger setup under somebody for 1-2 years, get confidence that you can manage a patient alone in that kind of a setup, because the type of patients in corporate and slightly different. So which way would be better, you feel?
I think like better to work under someone, okay, get the contacts also. They will have the good contacts and all. So anything, anywhere you go, you will get that contacts and how to communicate with the other department, how to communicate with the other people. So communication is very much important. You will learn those things. During the residency, you will learn more of clinical things, and about other things you will learn post your course. Okay, so learn those things, then you will get some time to observe which place to better for you, which place will be suitable for you. So then you can jump to that place.
Got it. So till now we discussed the pros of the branch and how to excel. So some disadvantages or cons of the branch also you should talk about, because we are coming to the end of the video.
Okay. So like when benefit and risk you take, definitely both are there. So but ultimately benefit is more, so that's why whatever the thing is there you have to take. Cons is like, that's only I told, like you will be like, some patients are struggling for 30 days. Okay, so everything will be going fine. Suddenly patient had pulmonary embolism or some bleed from the tracheal, patient will be dead. Okay, so that time first of all you will get negativity. Okay, meantime you have to be cope up the family members also. So that part will be there, but it is like you are doing the something different from everyone. Okay, almost like you are saving the life. Okay, so these things will be the part of the thing. So you have to be manage these things and you have to go. Apart from that one, recognition. Okay, it is a teamwork first of all. Okay, and critical care, everyone will tell okay what they are doing and all, but you should know what you are doing. There is no need to impress to other one. So if you know what you are doing, then no need to like impress or anything. Things will come beyond you only. Okay, so but you have to patience and you do your duty.
Got it.
Okay, payment wise, so like now because of the competition, so payment may not be get adequately, but if you have the patience and open your own centers, generate your own ideas, then you can have the good hope, like good future in the critical care, definitely.
Then I'm reading somewhere EICU concept, and from one central station they are operating multiple ICUs. What is your opinion on that?
Like some of the centers they have started. Okay, so like almost like it is 30 patients monitor will be there. Okay, so they're like a primary medical person will be near to the patient, so they will be giving the positive, like there will be continuously communication, so you can see the monitor and you will see the patient, and with your clinical knowledge you can take the call. Okay, so this is one thing, upcoming thing. Okay, so like legality wise bit some gray zone is there. Okay, but payment wise the rest of the parameters are good. Okay, but and there also 3 weeks will be, this work will be there. 1 week they will keep it in the bedside thing. Okay. They should not lose that touch and this thing, so that will be there.
So it's more like distant monitoring.
Yeah.
So you try to monitor centers where they don't have dedicated critical care teams to increase the safety of the patients in that particular hospital.
So if you want to go to overseas, then better to, if you are like planning to continue your rest of the life there, then no need to worry, you can go it. If you want to go for there 2 to 3 years and come back to India, means then do it critical care, because after 2-3 years if you come back, you want to try something doing the critical care, things will be entirely different, and whatever whoever your colleagues will be, their age difference will be there.
Got it.
So that's why if you are planning for overseas, especially UK and this thing, so finish some critical care degree, go back, work there, get the experience, then come back and work here.
So rather than going unfinished, finish everything in India and then go to abroad, Middle East. If you work there for 7-8 years and then you come back again, you don't have to read again.
Like you'll have the degree also.
You'll have the degree and experience also. So that's it, guys. So I hope you guys got a good and this has been a very highly requested video. Many guys have been asking, thanks to Dr. Girija for coming into this video, and my subscribers will be very happy to see this video. And next we will do one more video on critical care medicine. So it is like anesthesia, anesthetist led critical cares are there, and general physician led critical cares are there. So on that we are doing an exclusive video next. So one line about that, if you want to talk. Is there any difference in the
like I am from anesthesia, I am not like a biased opinion, but most of the centers are like run by anesthesia led intensivist only. Okay, because like anesthetist can learn the medicine very quickly, that may not be happen other way also.
Vice versa is
like difficult. Okay, so definitely if you have the dedication, will learn the things. Okay,
but airway management skills and crisis management skills are actually
these things like more of like things will be happening in the critical care will be like more of like emergency things. So that will be better managed by anesthetist. Okay, so even both ways possible. Okay, so
I think it's like a team. In the team, a combination should be there. Some general physicians and some anesthetists, if they're there, these guys will manage the airway crisis and everything. They will do the
more of medicine, like diagnosis and this thing.
And they will be good in counseling, diagnosis and those things. So thank you, Girija, for coming into the interview. And this video will surely help many people. And if you want to know more about critical care medicine, put in the comment section and subscribe to the channel. And all your comments I will get to Dr. Girija, and he will get the answers from him. Thank you very much.